Hi there, Jay. I'm seeing some people already joining us. Mom Doc South Africa. How's it, everybody? How are you? Thank you for joining us. We've got a sensational expert with us today. And in fact, I'm going to invite her right now to join us while she's joining. Parents, I hope you're well during this. Dr. Jo, how are you?
Hi, Kim. I'm doing well, thanks. Oh, well, that's my practiced answer. It's not the real answer.
I was just thinking to myself now, it's so nice to finally meet you, even though we spoke earlier and it's not a real meeting. At least technology is on our side today.
Yes, but it feels like a real meeting. I must honestly tell you that I'm excited every time that somebody wants to talk to me. We are peeking outside our windows when cars drive past so that we can see if there's somebody maybe just wanting to wave or say hello. So we are really missing social contact.
I know, and it's, as a therapist, that how important that is. But we are going to be talking. I think it's just gone 10 o'clock. I wanted to give it another minute before people join us and take a moment to say hi to all the Mama Magic followers out there. You guys are in for a treat today. And again, of course, thank you to Mama Magic for such a lovely platform and an opportunity for today. Dr. Jo, you and I mentioned this morning, and forgive me, everyone, if you can see screens in the reflection of my glasses. But without my glasses, I am totally blind, so I can't not have them. But thank you guys for joining us. How's it, Tennille, one of the Mama Magic team, waving at us over there? We mentioned this earlier, and I'm going to jump straight into it. One of the things, I've got two kids, but before we do, Dr. JoMarie, I think it's critical that we introduce you. For those of you who don't know, she's a play therapist and psychologist. You've had your practice established for the past 15 years now, which is incredible. And you've studied some incredible things around children. Please won't you tell us a little bit more about that before we get started so that everybody knows who we're talking to.
Thank you, Kim. Yes, my mom always jokes. She asks, why do I keep on studying? And it's because I do believe I don't know enough. We keep on wanting to know more. I've been in private practice for the last 15 years. So I've been doing psychotherapy with children mostly for the last 15 years. But what I have been doing as well, I have been trying to elaborate on my knowledge with regards to children in general. Yeah. So I'm doing infant massage, and I'm a big part of the practice of play therapy. And I've got children of my own, and they are better than any books I've ever studied. So they make me very humble, and I don't know all the answers. Definitely not.
Subjects with you, and our daughters I've got two girls as well, and you're into that potty training phase now yourself again.
Right in the middle of it, right in the middle. She's 28 months old. Wow. And I'm sitting and waiting to see when we should start doing it.
Well, doctor, that's no better time than to just launch into it. We are under extraordinary circumstances. It's lockdown. Most parents, I know that for me and my girls, having the teachers around was just wonderful in terms of potty training. And my 4-year-old just got the nighttime right, holding thumbs, crossing fingers. But tell me, what do parents do without the assistance of teachers at this point? How do they start?
Kim, this is hard. I think most parents depend on the teachers. They almost cue us to know what we should be doing and when we should be doing it. So all of a sudden, parents are lost. And I think there's also the fear that maybe if we do start with potty training, will we be doing it the right way? Will we maybe not confuse our children, and when they go back to school, they will be completely doing it a different way at school? So I think one of the most important things that needs to happen, schools will definitely need to communicate to mums and dads to explain what they do expect, and if it's in actual fact the right time to do potty training. From my side, I'm not sure whether I am going to do potty training now. We are in the middle of lockdown. one would assume it's the ideal time. I'm at home, my child's at home, we've got ample time to do it, but it's not a very stressless environment. It's actually quite stressful. So one would need to decide whether I actually want to introduce potty training at a time where my child can see things are different at home. Mum's stressed or dad's stressed, or people are at home that are usually not at home. So it's a very big decision to decide whether one would like to do it while you are in the middle of lockdown. And obviously, it's something that one needs to talk through because we're not sure when children will be going back. So we can't wait for the next year and not train. But maybe if they go back within the next few weeks, one should rather wait and see what the schools advise regarding the potty training class specifically.
And that brings me to my next question. You mentioned this is a stressful time for us. Do you think that, say you feel your child is ready, that kind of the stress that we're undergoing collectively could have an impact on the kids, never mind the parents, but it's also strange for the children? Sure.
For sure. Okay. I do, however, think luckily, and we are so grateful for that, children are so resilient. So they tend to bounce back so quickly. And we can just try the best that we can. So I do think it can play a role, definitely. And if parents maybe are too stressed, one should not opt for the potty training to take place now. And it's like most things in life. So if I'm pregnant with a sibling now and I'm about to deliver, maybe I will not be doing the potty training now. Or if we've just moved house, or if maybe somebody that used to live with us all of a sudden does not live with us anymore during lockdown, maybe I would also not do potty training. So there's so many different factors that comes into play that one really needs to make 100% sure that when you do the potty training, that things are as relaxed as possible, so that your child does not associate this training phase with stress or unhappiness, or mum being over angry or anxious about this. It should definitely not be like that.
That makes a lot of sense. And to the parents who are online, I'm just going to turn my attention to you guys for a little bit. If you've got any questions for Dr. Jo, please pop them into the comments section and I will gladly ask her those questions on your behalf. So don't be shy, ask those questions. I know Dr. Jo is the right person to get talking to us and guiding you through this time. And one of the questions that I had written down for you, because like I said, my 4-year-old just about got it right, fingers crossed, is talk to me about the relationship between the parent and child, because I know it can be frustrating. My sister, I have a nephew who's about to be potty trained. I see my sister's online, and he is not at school yet. So what can we expect? Where do we start from a headspace perspective? What's our relationship with the kids at this point?
Yes, Kim, it's such an important question that you're asking. Where do we start? Because I think sometimes we just jump in. And now, especially during lockdown, I know I'm jumping into lots of different things without really thinking about it. So maybe the first question is not where to start, but maybe should we be starting and when should we be starting then? So I would suggest that we look a little bit away from chronological age. So sometimes parents believe that at the age of 2, we need to do something about this. And you'll even get friends and family asking you that very horrible question. It's that same question that they ask sometimes, when are you going to get married? And when are you going to have children? The other one is, she's still on diapers. So it's the same kind of question. Parents should definitely not focus on the chronological age, and they should maybe look more for readiness skills. So maybe that's the way that I should answer your question. We are in the middle of lockdown. We've got children. They are at the age that we think they should be potty trained. What should we be looking for to know whether they're ready to be trained? And one of the things probably is we want a child that reached their developmental milestones appropriately. So we know that if there's a little bit of a developmental delay, generally they've crawled a little bit later, they've walked a little bit later, maybe they will train a little bit later with regards to being potty wise, and there's nothing to be concerned about that. The other thing is they should become aware of their bottoms. They want to show you if there's a poo in their nappy. And some of them will actually go to the toilet and they want to pull down their diapers. these are all signs that one can look into and decide, well, maybe they are becoming and they are realizing that this is something that they would like to do. Some of them also join you when you go to the bathroom. I don't know if that happens to you, but it
No, all
happens
the
to me.
time.
Yeah,
Down.
I pee with an audience. Yes, it's like horrible. But we should use that to our advantage. They sometimes even come and have a look what's in the toilet. So these are all cues for us to know that they are really setting the stage or the scene, almost to speak.
Yeah.
They want to know more about this. Some of them will show you or they'll indicate when they are about to have a bowel movement. And that also gives us an idea that the neurological pathways from the brain to the bladder, these things are becoming mature.
Yes.
So if they indicate that they want to have a bowel movement, we get a thumbs up, we tick off our list, we know we are heading into the right direction. You know, I've got my second born used to hide around the curtains, and then I know, well, something is cooking there. So it gives us cues that we know that they are about to become ready. So parents should look out for those readiness signs more than what they should focus on the age, or when other family members are encouraging it to happen by itself. So look out for those, and then maybe it's the right time then to start introducing the potty training.
Oh, well, on that note now, I've got Nolly actually asked Mama Magic yesterday already. I hope she's online. She said her daughter is 1 year and 8 months, which is about 20 months old. She's not speaking. Is she ready to start potty training? Is that a sign at all?
I'm so scared to just say no, because with children we know that there's a wide variety and a wide range of normality. So some children might be ready at that very young age, but generally not. So we would also like for them to have some form of speech, to be able to say wet, or that they need to go to the toilet, or use potty words. So I would generally say not yet, and maybe just start setting the scene for her if you believe that there might be some indication that she is ready. Read books about potty training. You know, you get these nice dollies. I brought my girl's doll with today. They sit on a toilet or a little potty. So you get these things and you play around with them. And children almost, they start knowing that these things can happen. It's part of their new norm now. So I would actually encourage Nolly rather to do that now instead of focusing on potty training.
Okay, perfect. That sounds good. Nolly, I hope you heard us. And then Natasha also asked the Mama Magic team to ask on her behalf. And this leads me to my next question. What's a normal, before we get to Natasha's question actually, is there a difference between boys and girls? I've only got girls. My sister's got a boy, so that's going to be my first experience as the auntie. Is there a difference between girls and boys when it comes to potty training?
Yeah, definitely. And they pee on you. It happens. Yes, they do. Yes, there's a difference. So generally speaking, again, we feel that boys are a little bit slower. My husband always jokes, we have this joke at home. I always say, well, men in our house tend to be a little bit slower. So generally boys are a little bit slower. So don't be that hard on your little boy if your little girl trained at the age of 2 years and 7 months. So we know if we look at statistics, little girls more or less around 32 months, they learn to train, or they are dry during the day. Little boys more towards the age of 35 months, 36 months. So can you see we are moving already towards 3 years of age? So our whole norm of change or training children at the age of 2, it's maybe too early. We are putting a lot of stress on them. Maybe we should wait first and check those signs, and then we'll see those signs are happening a little bit later only. So with boys and girls, yes, we do have differences. They are a little bit slower, the little boys. And then obviously they wee differently. They stand up and they don't sit. So moms are always kind of anxious. So how should I handle this? And they pass the bucket on to the dad.
Yes, if there's just mum, what does she do?
Yes. The idea would be for mum to maybe encourage the little boy to first sit down and get the hang of it, not to stand up. They need to balance, and they need to control stopping and starting, and they need to actually aim, and that's a hard thing as well. So the best thing is maybe to get them to first get comfortable with the toilet or with the potty by sitting down. And then if you see they've got this thing going, they can actually control it to some extent, then start practicing standing. And maybe I should not say this online, but I know little boys peeing outside in the garden. And maybe that's one way of doing it. Or standing in the bathtub and peeing in the bathtub. So this is how this is how they exercise this. Way different from little girls. They don't do it that way. So there's a little bit of difference with regards to boys and girls. And although little boys train later, they sometimes train easier. They are not such hard work because they take it out and they do whatever they want to do whenever they want to do it.
They're not shy.
No, not shy. I sometimes wish they were a little bit more shy. I've had very embarrassing moments with my son, but there's a bit of a difference then. And then obviously with little girls, we also need to teach them to wipe, which we don't need to teach for little boys. So our frame of reference changed a little bit when it comes to boys versus girls.
Doc, I have a really nice question. I think it's Kilo or Kilo. She says she's got a pigeon pair set of twins and they're ready to train. Twins, double. How does she even begin?
Well, one of them will lead, and I think you'll find that with twins. We'll always see that one twin leads, and then sometimes they swap after a while, but she should check out and see who's going to be the leader in this, and then allow them to lead, because possibly the chances are great that the other one will follow. So maybe she'll only have one to train, and the next one will just follow suit. The little girl will probably learn a little bit quicker or earlier, and she should not then shame the little boy. I think that's something else that we can also talk about. Potty training is not about shaming or blaming or getting upset or losing your patience. It's really nothing like that. So for her, I would advise first watch, see who's ready, more ready than the other one, and focus her attention on that little one. The other one will follow suit quite quickly.
And in the case where the little boy leads, could she expect her little girl maybe to want to stand if she sees her brother doing this?
Yes. Some of them do. And then you allow them. Maybe in the bathtub and not in the toilet. So you will allow them. You'll tell them, well, if that's what you want to do, let's go for it. And they quickly realize that they don't have the equipment to do it. So they figure out this is not that easy standing up. A little girl realizes that she doesn't have the capability of standing up, and they lose interest quite quickly. So don't make a big fuss of it. Just tell them, oh, well, let's see if it works. Go for it. And they do it once or twice and they stop wanting to do it.
And I suppose that they're smarter than what we give them credit for. Kids are always the smart ones. But Doc, I was just thinking about it now. One of the things a friend asked me, actually, she is going into that phase as well. It's her first little one. And she said it's winter. She's heard that you should try not to potty train during the colder months. What's the story behind that?
It's a general recommendation. And there's a few reasons for that. The one being it's more difficult because we layer children with clothes. Now, all of a sudden, when they do have the need to go, we need to unlayer them. And sometimes then they can't hold on and they have a bit of a blubs. They wee in their pants. And then it creates all kinds of issues. So you as a mum become frustrated. You need to keep on changing to dry clothes. And the little one becomes anxious because they feel that there's this rush to get them to the toilet. You need to pull down the pants and maybe you've got tights on as well. So that's one of the reasons why. The other one is, I know from my own experience, if it's winter, it's sometimes not nice to go to the bathroom. It's cold. So you'll also find that little children hold on because it's not such a nice experience. The bathroom is cold. The toilet seats feel cold. So generally, winter is not the ideal time. And luckily, South Africa is a sunny country. We don't have that many winter months. We would often encourage parents to wait a while until it's a little bit warmer. But now again, if my child shows signs of readiness and I'm right in the middle of
and now, okay, perfect. You paused for a little bit there, but you're back. So that's great. I'm sure all the parents heard you. And I just wanted to find out, you said make this fun for the kids when they start. You're the play therapist. Give us some tips. How do we
You
make
need
it
to have
fun?
a sense of humor, Kim. You need to have a sense of humor. And you need to have a potty sense of humor. Because children also learn all kinds of potty words. So my 2-year-old just started calling me poo-poo head. Now, I mean, really, it's not the kind of name that I want to have for the rest of my life. But if we make it fun, and if
Yeah.
we laugh a lot, and if we design little rhymes and verses that we can say while they are on the potty, and if you can do
Yes.
the Macarena while they are producing the sample, it makes things a lot easier for you and for them. So think out of the box a little bit. If you've bought the cloth underwear and you have the
Yes.
potty and you have everything handy, then get a few props in that makes it nice. Put on a funny hat every time when they go into the bathroom and wait at the door while they're doing what they need to do and do a silly dance. It really makes things easier for you and for them. And sometimes it helps them to hold on. So with my own 28-month-old, she'll wait until I put on my silly hat before she wheezes in the
Okay.
toilet. So you actually practice and exercise some of those muscles at the same time.
Oh, wow.
Reading books, singing songs, and then sitting down right next to them on the bathroom carpet, waiting while they are doing it. Always great things to do. It makes it easier for them.
Awesome. So you're saying lift the pressure from ourselves and the kids a little bit. And then
Yes.
one of the things I know, like I said, my 4-year-old just got the night times right. Bedwetting. Please help the parents. That's a dreaded one. What should we expect? How do we respond to this period of time? Because it's not, the kids don't feel good about themselves either.
No, they don't. I'm so happy nowadays in South Africa. We've got this dry nights campaign going around with, I think, Dr. Michael Mole, and I really think he's quite an expert on bedwetting. So if parents are concerned, I would direct them to his website. But what we can maybe discuss today, we are again putting a lot of pressure on children. And whether it's just the way we live nowadays or the expectations from the general public, but
Yeah.
that should not be the case. So to answer your question, we should not be concerned with bedwetting at night before the age of 4 or 5. It takes a long while for them. And then even after the age of 4 or 5, they'll still have wet nights, and that's still normal. And research now says even up to the age of 6 is still normal. And if you hear Dr.
Wow.
Michael Moore talks, and I'm sure maybe if he watches this, he will confirm this. He sometimes even said, I think even after the age of 7, one should first start investigating. So we should change our frame of reference. And with night sheets and pull-up pants, it makes it easier. So don't pick a battle that's hard to fight. I've got a 5-year-old boy, and he's still bedwetting.
Oh, wow.
I don't know. I don't hope you ever watches this.
She had an oopsie the other night, and she's 4.
Yes. Yes. So what do? I don't make a big thing out of it. So I arrive in the morning and I see, oops, there was something happening, and I'll make a comment about it. I'll say, oh, you did not see that one coming. Hey, let's quickly clean this up. And it doesn't happen every night, but when it does, I do not make a big hoo-ha about this because we do know it's rarely psychological in nature. It's often neurological maturity that needs to take place, and you can't blame a child for that. All those nerve pathways need to be fixed first, and it takes time.
Sure. And we shouldn't rush it, as you said earlier on. And then I think the last question that I'm going to ask you, unless there are other questions that have come through, but the last question I want to ask you, Doctor, is at what point should parents be concerned? Do they even have cause to be massively concerned? How can we help them?
Generally, don't be concerned. So that's my general answer. When should you become concerned? If your child shows other delays in development as well. So if it's not only a potty training thing, but my child shows delays in other areas of development, one should definitely have a look at that then. And after the age of, let's say, 3.5, if there's no daytime bowel attainment, if they can't control that during the day, then one would often also want to look into it. If constipation is also, if you see that, if that's evident, one will look into it. And if there's a constant infection for little girls, one will also look into that. So these things are medically issues that one would need to investigate. But if you've been training for 2 weeks and you don't see much happening, don't become stressed.
Don't panic. Don't panic. And there you have it, everyone. Doctor, it's gone so quickly. Can you believe it? That brings us to the end of our session. Thank you so much to everybody who joined us. Dr. JoMarie, baie dankie. You are amazing and a wealth of knowledge. Thank you so much for joining us. And I know you've got a packed day ahead too. So enjoy the rest of it. Thank you so much.
Thanks, Kim. Bye-bye, everyone.
Have a lovely day. Thank you,
You
Mama. And thank you to everybody who joined us, mums, dads. I hope this helped you. And we will see you again for the next live tomorrow.